I'm Meg LaPorte with Provider Magazine, and we're here today with Gary Kelso, who is President and Chair of Mission Health Services in Salt Lake City, Utah. Gary, could you tell me what results you've seen in your residents and maybe your staff, I guess throughout your whole organization, as a result of the Eden Alternative journey?
You know, Probably the most striking result we see is the quality of life for the elder. We call them elders as opposed to patients, because the elder has grown. So often, when someone comes to a long-term care center, there's this perception that they're there to grow old and die.
Mm-hmm.
But when they come to an Eden homes believe that a person's life is not over. A person's life just continues. And that continuation of life provides an opportunity for people to be engaged in the day-to-day uh, life of that person, becoming world makers. And doing so, our staff thrive. And as our staff thrives and is engaged with that elder, they thrive. In fact, if you look at even quantitatively, we see things such as our turnover rates have consistently dropped. When I stepped into Mission 8 years ago, we had the typical 50 to 60 to 70% turnover of our staff. The last 3 years we're below 12% in our turnover rates. Just by that. If you look at the numbers,
That's
what does that?
incredible.
Yeah, what does that say? If a staff person feels valued, feels engaged in what they do, then they don't want to leave. And our people don't leave. We typically have a waiting list for employees to come in. And that's not because we pay more. It's not because we do anything different. What we do is we provide that vehicle for that staff member to feel like they are a care partner in the care that's being given with our elders. It's pretty amazing.